An aid organisation draws a bleak picture of the healthcare system in Afghanistan. Doctors Without Borders says access to healthcare fails to meet people's needs and is overly influenced by political and military considerations. So what have years of international aid and investment achieved in Afghanistan? This is Inside Story. Welcome to the programme. I'm Shihab Ratansi. Afghanistan has one of the most inadequate healthcare systems in the world, something that contributes to a life expectancy of just 44 years. All this despite the hundreds of millions of dollars that have been pumped into that healthcare system over the past 12 years. A new report by the aid agency Médecins Sans Frontières, or Doctors Without Borders, says 1 in 5 people had a family member who died because they couldn't get access to a health facility. Bernard Smith has more from Kabul.
If you were born in Afghanistan, the odds of making it past your first birthday are still the worst in the world. Médecins Sans Frontières has found that patients in the most volatile parts of the country have seen little improvement in their access to healthcare despite more than a decade of foreign military intervention here.
Most of the women that come here, they come from far away. From the mountains. It takes them about 2 hours to get here, and some of them start working from 6 a.m.
MSF's report is critical of what became a cornerstone of the International Security Assistance Force counterinsurgency strategy, the Provincial Reconstruction Teams. PRTs, made up of civilians and military, were tasked to win over local populations after their area had been secured by ISAF forces. But MSF says there was little long-term thinking involved.
We have a lot of health structures that have been nicely built but are empty. We have a lot of basements full of donated equipment, but then we have no maintenance, we have no fuel. So I think having this kind of initiatives that were just coming out of the blue and were serving political aims, well, they were not sustainable, and I'm even wondering if they ever worked.
MSF says that although the number of health facilities has increased in Afghanistan, people either can't afford to use them or they don't trust the service provided. Afghans are still bearing the brunt of the cost of healthcare here. According to MSF, Afghans spend about $40 if they need treatment for an illness. That's an enormous burden in a country where most people are earning about $1 a day. And MSF is worried that as foreign forces pull out, international interest in Afghanistan will go with them before there's been any significant improvements in healthcare. Bernard Smith, Al Jazeera, Kabul.
Well, to talk more about the difficulties facing Afghans accessing healthcare, we're joined by our 3 guests. In Kabul, Dr. Ahmadjan Naeem, he's the Afghan Deputy Minister of Public Health. In Brussels, Christopher Stokes, General Director of Doctors Without Borders. And in London, Heather Barr, Senior Researcher at Human Rights Watch. Welcome to you all. Christopher Stokes, then, improvements in the Afghan health system are presented as one of the few tangible benefits of invasion and occupation. The best thing the US ever did, according to one headline I remember. Are you saying that's not true?
Well, what we're saying is that perhaps that picture isn't as positive as perhaps some political and military entities wish to present it. We've seen a doubling of the number of patients come into our hospitals over the course of the last year. And so what we did is we actually did a survey and asked the Afghan patients themselves what they thought and what had happened to them over the last year. And the picture they described is actually not one of a huge success from their perspective, especially in terms of access, insecurity, cost and quality of services.
Yeah, that's interesting. You mentioned access, because that's a term we often hear, improved access. But your report says, well, we have to be careful with that word because that can be confused with geographical proximity, but not actually the ability of a healthcare provider to provide healthcare.
Yeah, and it's often portrayed as this part is often portrayed as a big success, with a number often given is that 85% of Afghans now have access to healthcare compared to 9% in 2001. And actually, in the survey that we did with our patients, one of the things that came out is many people actually didn't come to health services because of insecurity. Actually, 1 in 5 of the patients we interviewed had a member of their family or a friend in the previous year who died through lack of access to healthcare, and this is due to insecurity, checkpoints, the cost as well of travelling, and also sometimes the fact that the clinics that are supposed to exist, that exist on paper, are actually buildings but without any drugs or without any qualified medical staff, so they have to go quite far away into the main towns to seek access to healthcare. So basically they're really facing a very grim conflict reality in Afghanistan today.
And this is in the context of so much money having been spent. Let's just remind ourselves of that. The US has been pumping billions into Afghanistan for more than a decade. According to the Special Inspector General for Afghanistan Reconstruction, the US has spent over $100 billion now on reconstruction since 2002. Of that, more than $1 billion went on healthcare. Almost a third of all health facilities in Afghanistan are supported by the United States. But these are just the US figures. As far as total international aid goes, there's no reliable figure because so much of the money has bypassed the Afghan government itself. Before I bring the rest of the panel in, though, Christopher Stokes, I wonder whether, when you look at the last 12 years, is healthcare being used primarily to help the Afghan people or as a tool of counterinsurgency, or as a tool to show progress in counterinsurgency, would you say?
Yeah, that's a very good point. And actually, of course, for the Ministry of Health in Afghanistan and for a lot of people working on the ground, healthcare is a core issue, and health assistance should be provided based on need. However, unfortunately, what we've seen over the last decade is that healthcare has been part of the Hearts and Minds campaign. Areas have been supported not only based on needs, but based on the kind of military strategies that were to be deployed in that area. So we could say that healthcare has somehow been integrated into part of the conflict and part of the strategies. And this, of course, hasn't helped the health centres in terms of their perception as being neutral and safe places for Afghans to come to. This has probably compounded the problem for Afghans.
Heather Bardo, what's interesting is that, according to the report, there's quite a bit of awareness of how useless a lot of these projects do turn out to be, even though they cost such a fortune. They even have their own nicknames, these humanitarian projects. Quick impact, quick collapse. I mean, what's going so wrong here?
Well, I think it's a complicated picture, and Chris has touched on some of the issues. Certainly this kind of merging of development assistance with military strategies has been deeply unhelpful, and is something that I think we'll look back on Afghanistan as having been, in a way, the death of the separation between aid and military strategy, and that having been a terrible mistake. I think there's been an overall problem of accountability for aid. I think that the international community has not dealt well with issues about corruption, both within their own programs and within the Afghan government. And I think that what's really concerning is the statistic that Chris cited about how the number of people seeking services has doubled in the last year. I think this is an indication of something really disturbing which is happening now, which is that having made some progress, having learned some good lessons and some bad lessons along the way, rather than sort of building on that and looking at why have things not worked that well, how can we improve it, how can we sustain the progress that has happened, there's much more of a desire to just walk away and say, well, we did what we could and it's up to the Afghans now. And I think that would really be a tragedy.
Yeah, but Heather, isn't that proof then that this was never about the Afghan people? This was about geopolitics, and that's just how it's going to be. No more night raids, no more aid.
Well, that shouldn't be the case. I mean, unfortunately, it feels like you're right. It feels like the message now is you sign the BSA or we're finished with you, and you can't have anything.
That's the agreement to allow
but
US troops to stay.
That's not right at all.
Dr. Naeem, though, it's great having you on because you've had a long history both with the WHO and NGOs, and now you're in the Afghan government. So first of all, with your WHO hat on, the World Health Organization hat on, to what extent have NGOs and aid agencies contributed then to the waste of time and money by being part of this counterinsurgency strategy and being an instrument of soft power instead of helping the Afghans themselves?
Thank you very much for the question, and good evening to everybody. In my opinion, first of all, I would like to thank MSF, for the services they have been providing during the years of conflict and following the conflict and insecure areas. And they lost some people in 2004 in one of the provinces of Afghanistan, and they returned in 2009. Basically, their mandate is a humanitarian mandate, and by mandate, probably research was not, one of their areas of specialty. And secondly, any studies, that are conducted which involves human subjects, I believe, it should go. Those research proposals should go through ethical review board.
Okay, so you're wearing your ministerial hat then. We're going to forget about the World Health Organization, clearly. Christopher Stokes, what about that point then? You don't do research. You help people in a humanitarian way, but when it comes to research, you're just not very good at that.
But of course, the aim, we also do in epidemiological investigations when we're faced with epidemics. And what we did in this case was interviewing the patients. Because one of the problems we face in Afghanistan is there's a lot of discourse around Afghan needs and the successes of the different interventions, health interventions, for example. But we considered that what we were seeing on the ground conflicted a little bit with the good news stories. So that's why we decided to interview the 800 or so patients. And I think they give a pretty fair, accurate description of their day-to-day realities, the difficulties they face in their regions, the distances they have to travel, the insecurity, and the fact that some of the health centres that they would wish to go to really aren't functioning properly, especially outside of the major towns. And I think for MSF and for other aid organisations, we have to recognise that we also haven't been, provided part of the solution there, because we're treating more and more people in the towns, but it's very hard to go outside of the main towns because we're dealing with the same kind of insecurity and difficulty that the Afghans are dealing with, the checkpoints, the landmines, etc. Half of the people who reported not being able to come cited, over half of them cited violence and conflict as being the main reason that they delayed or weren't able to access health services. And this is really the day-to-day reality of the Afghans, beyond the statistics or beyond the public discourse, if you will.
So, Dr. Naeem, you don't accept those findings?